My name is Dr. William Doss. Hello, everyone. Thank you for joining us today. It's great to have so many of you listening live. We are very excited to be able to facilitate this discussion and excited for the opportunity to hear from the experts and those working locum tenens. This is hosted by the Howard University Medical Alumni Association as well as CompHealth. And before we get started, I wanted to go through a few housekeeping items. As a reminder, you can't be heard or seen. However, you will be able to address any questions to myself and the panelists throughout the discussion by clicking on the Q&A feature at the bottom of your screen. I will be reviewing those questions throughout the discussion and will answer as many as we can. If for some reason you are having technical difficulties, please submit those issues into the chat feature at the bottom of the screen, as we have some support staff standing by to address those issues. Lastly, we are recording this webinar and will publish as quickly as we can after we finish. You'll receive an email with the link to the session as well as a short survey which will help us in planning upcoming content. Okay, so that should be all the housekeeping items. Let's get started. First of all, I'd like to introduce our panel. Our first physician is Dr. Rishi Shah. Dr. Shah is a phenomenal pulmonary physician. He trained at Northwestern Marion George Hospital in Wheaton, Illinois, and completed a spinal cord injury medicine fellowship at Baylor College of Medicine in Houston, Texas. His clinical interests include stroke, spinal cord injury, and pain management. Dr. Shah enjoys spending time with his family, teaching his daughter to swim and playing soccer. Our second panelist is Dr. Todd Holmes. Dr. Holmes is graduated from the University of Minnesota Medical School in 1982. He completed his training in PM&R at the University of Minnesota in 1986 and has been board certified in PM&R since 1987. He has worked as a staff physician at the Minnesota VA Hospital and at Sister Kinney Hospital in Minneapolis, and has been on the teaching faculty at Michigan State University since 1989. He's been in private practice at PM&R since 2001 and returned to locum tenens in CompHealth in 2013. He's worked several locum tenens jobs in Oregon, Wyoming, Arizona, New Mexico, Nebraska, Oklahoma, Minnesota, Iowa, Virginia, Delaware, South Dakota, and Massachusetts, just to name a few. All right. Our third panelist is Dr. Dolores Irby. Dr. Irby was born and raised in Houston, Texas, the first of 6 children to go to a 4-year college at MIT and graduate with a BS in mechanical engineering. She returned to Texas for medical school training at University of Texas Health Science Center in San Antonio and continued there for completion of her PM&R residency in San Antonio. Her and her husband raised 3 children, and she has 2 nephews and a niece in San Antonio. After working as a general PM&R physician and being medical director of 2 different rehab units, she started locum tenens with the goal of having more time off to spend with her husband, who has just retired. As for myself, I am Dr. William Doss. I'm the president of the Howard University Medical Alumni Association. I am a 1991 graduate of Howard University College of Medicine and completed my internship at Henry Ford Hospital in Detroit, Michigan, and my residency at the Baylor College of Medicine in Houston, Texas in 1995. I have extensive experience in musculoskeletal medicine, electrodiagnostic medicine, pain management, and acupuncture, and I've also done a significant amount of inpatient rehab. I currently serve as a pain medicine physiatrist at the Hampton VA Medical Center in Hampton, Virginia, and I have been working with CompHealth and locum tenens assignments since 2004. So first of all, I'd like to thank everyone for taking time out of their day to discuss how you have used locum tenens in your careers. So I'd like to start off with the first question, and let me finish one other thing. CHG Healthcare and Hanover Research have been conducting a locum tenens awareness and perception survey, LTAP, for the last 7 years. We will base the questions in this webinar off the most common questions that have come out of that survey. The topic of locums is widely known by physicians, generally speaking, and the majority of physicians have a very positive impression of locums. That said, there's quite a few gaps with specifics. And we'll do some from the LTAP survey of 2019. Just a side note, this is Locum Tenens Week, and so I'd like to celebrate Locum Tenens Week. And literally, Locum Tenens comes from the Latin, means the placeholder. And so it is kind of, the other term for it is lieutenant, which is in French. and basically it's kind of the second in command. So when someone, the captain or whoever is off, then the second in command, the lieutenant, takes over. And so that's kind of what locum tenens is about. All right, so let's start off with some questions. This is directed to all our panelists. The question is, what is locums and how does it fit in your life? And how do you utilize locums? Okay, well, Dr. Shah, we'll start off with you.
Okay, great. Yeah, so for me, what does locums mean? For me, it meant balance for me. I was able to balance my family life as well as my work life. When I was at work, you were at work, and when your assignment's done, you're at home on vacation as long as you want, and how you set up your schedule. For me, my wife worked, and I took care of my daughter during the times that I was off, and then at times that I wasn't off, I went and worked, and we were able to kind of keep our head above water with that, which was, such a great asset to be able to have benefits in both of those worlds.
Dr. Irby.
Yes. So I've been in private practice for the majority of my career in San Antonio after I'd finished my residency, and basically continued to do general rehab, including inpatient. And as I was trying to wind down my career, I guess you could say, I basically was able to close my inpatient practice and continue doing, not my inpatient, my outpatient practice, and continue doing inpatient. So as the director, I was a medical director for a couple of different units in San Antonio. And after my husband retired, I was like, well, I think it's time for me to more or less slow down so we could, spend more time together. And I decided to give up my directorship, and somebody gave me some advice, and I contacted the CompHealth, and next thing you know, I've been doing this for a couple of years now. And a lot with, like Dr. Shah just alluded to, a lot of it was for being able to take time off and work when I needed to, or when I could. So I do get, when I'm not at an assignment, I'm at home and spending good quality time without having to be on call or anything. So that's what it means to me right now, and it's been working out pretty good. Outstanding.
Dr. Holmes.
Well, I started locums sort of in between jobs when I was just out of medical school residency. I did a rotation, I was an attending at the VA, and then I left that, and then I did a locums job that filled the gap before I took another permanent job. And it was fun. I liked doing it. And after many years in private practice, they twisted my arm to come back and try it again. And it was scary to go from an outpatient experience back into the inpatient world. And I discovered I really liked it. And I kind of just let my own private practice dwindle down while I kept taking on more and more of the inpatient assignments. And as you noted, I've been in multiple states. I've had a lot of really wonderful experiences, got to see places in a way I wouldn't have been able to do unless I was actually working there. So for me, it's the blend of being able to travel, get to experience a lot of different things, and have a lot of fun while doing it at the same time, which just doesn't seem to fit in medicine these days. I think the big issue with my private practice was I was getting beat up by the insurance companies and paperwork demands and stuff like that. And in a locums job, those things all disappear. And so it's very discreet. It's easy to manage what's going on in a locums practice for the most part. And I enjoy it.
Okay. And just from my experience too, I think the locums is nice transition, if, as Dr. Holmes mentioned, going between jobs. And also I kind of I've used it as kind of a way to make some extra income. And when I've had trips that I wanted to take and with my family, just a way to kind of finance that. So it definitely helps out with that as well. We'll do a follow-up question. So this is, again, to all the panelists, discuss the options and opportunities with locums and having your recruit as an advocate, choosing your locations, choosing how long and when you want to work. So we'll start off with Dr. Holmes, since you've done so many.
Well, some of it for me is what fits into my calendar. You know, and as others have mentioned, if you're trying to get time off or you don't want to work, you know, 180 hours a week kind of a thing, it's one way to do it. You say, so I originally set up that I'd do like 2 weeks a month. And then I'd have the other 2 weeks to be able to keep my outpatient practice going. And as it's evolved, there are some opportunities that are more long-term, like maybe they want somebody for 3 or 4 months straight, and other ones where maybe they only need somebody for a couple days. So you've got a lot of variety that way. I've been a little limited in terms of there's the states that I have licenses in are easier for me to get jobs, where some states take a year or longer to sometimes get a license. So, you know, in some ways you don't have quite the wide range of flexibility you'd like to have to say, oh, I want to go to California now. And then you find out, well, it takes a year to get a license. Or some states, the jobs pop open and they're snapped up almost right away by anybody because those are desirable locations. I found my calling really in the smaller markets, smaller cities and things where there isn't a whole lot of demand, but also we're like the only game in town. Sometimes we're like the last hospital before Wilderness. And so we get a lot of stuff coming at us without a whole lot of resources to take care of it. And I like that.
Okay. Dr. Irby.
Yeah, I definitely have experienced, I kind of, like what you were saying, Dr. Holmes, a lot of the more desirable locations like California, I think are harder to get into. But as I've been finding, the locations I've been working at are in the smaller community or smaller towns, and you're right, they don't have as many resources, but they definitely need our services as far as like they have a rehab unit and they don't have, you know, a lot of people trying to get that position. Say, for example, if they're trying to hire a medical director, but they haven't been able to hire one. So they kind of use locums to fill that position, and they're in the locations I've been at are usually, you know, pretty good rehab units. They're fully staffed. It's just that they can't find that PM&R doctor. So we're in demand out there. So that's one good thing I see, and they really appreciate when we do go out. When I'm out there, I feel like I'm really appreciated. And for the most part, the units are fairly well run, so it's a good experience. I know there have been some times, you know, like when you don't have, you know, neurology or neurosurgery, and you have to make do with what you have, and you have to learn the system. It's kind of like, you know, not knowing who to contact. So sometimes it can get a little stressful, but for the most part, you have a very good staff that can, you know, help you out and make sure you get in touch with the right folks. And the other, the physicians in the hospital are also very helpful for the most part.
Dr. Shah.
Yeah, I think, you know, the relationship with the recruiter is really important. I think, you know, that's why I worked with locums well over 2 years and continue to do so, just because, you know, the relationship that you develop. And, you know, some of the places that you're talking about, I worked in, you know, big cities, and I also worked in, you know, some of the smaller and I guess more rural places all over the country as well. And it's, you know, it's more that relationship you have is really, really important. They can say, hey, we've had locums doctors, PM&R doctors in there before. This was their experience. This is what they kind of said. So you have a little bit of a heads up. You want somebody that's well experienced and somebody that also kind of has your interest in mind as well, not just trying to fill a spot. If they, you know, you get to know them over time, and I think it's a really, really important relationship, if not one of the most important relationships through the whole locums process that can go on.
And I'll just kind of make an aside and just kind of finish up this part by saying that with even the smaller hospitals or the smaller communities you go to, they're very excited to have you. And I think that's the nice thing, that you're very much appreciated. So I've done some work in Bismarck, North Dakota. I've done New Hampshire. I've also done New Iberia, Louisiana, and very, very excited to see you, very excited to have you. They kind of roll out the red carpet. And really, with a lot of hospitals these days, particularly if you've done it for a while, in terms of you don't necessarily get that red carpet treatment. And so I think there's definitely an appreciation there for what you're doing, and I think that makes a big difference in working locums, and then also CompHealth helps out a lot with introducing you and putting your file to different hospitals. Next question, we're going to go with Dr. Shah. Dr. Shah, how's your work-life balance when working locums? I know you talked about it earlier. Just if you can go in a little bit more detail.
Yeah, I can absolutely do it. I think, Dr. Holmes and Dr. Irby also touched in on it. When you're at work, you're at work, and when you're not, you're not. So it really helps. Unfortunately, and a lot of other doctors that, you see through residency, whether it be your attendings or even moving on, like your other colleagues as they become attendings, the hospital can really swallow up all of their life, and it kind of can bleed into, taking away a lot of time from their family. What was nice, I thought about locums is you have the power to, say, hey, this is what works within my schedule. And that's when, you work closely with your recruiter to kind of figure out what jobs are right for you, and, where you're able to give, where they're able to give, and kind of meet in the middle to really provide the best life that you can kind of for yourself. For me, it was absolutely amazing. I got to, help raise my daughter as it grows. Just a little like side story about that. I was working locums, and there was, it was a bigger unit. So there was an older doctor there, and he was closer to retirement, and I was telling him what I was doing, and he kind of just like looked at me, and he was like, oh, I really wish I did that when I was your age. I kind of miss those years with his kids, moving forward. So, that story always really stuck with me, and kind of made me feel good about the decision of what I made.
Okay. All right. And just as an aside, Carrie, I wanted to kind of bring you in on this a little bit. We've had a couple of questions. One that from a few people that saying how the locums assignments with the coronavirus, how's that coming? How's that been affected, and has that picked up? I know it was down for a little while.
For sure, and yes, it definitely has impacted us. We are starting to see it gradually creep up a little bit, not as quickly as we would like. I think right now things are still so uncertain, but it definitely has been slower than normal, but we do expect it to get back to normal. When that is, we don't know. But we're still opening jobs, just not as many as we were pre-COVID. But hopefully, again, I'm hoping sooner than later we'll get back to normal.
Okay. All right. Next question I have for, this is directed for Dr. Holmes. Dr. Holmes, I know you've talked about this earlier, but let's talk about the benefits of locums. You get to try before you buy. Can you speak to that?
Well, in some ways, some people may be looking at a permanent job, and there's the idea of you could take a locums job that transitions to permanent. And so some of the places I've been at, they really liked me. They wanted to hire me as the permanent medical director. And so I went through a bit of looking at those contracts and so forth, and it never ended up working out, partly because it was always a reduction in pay in terms of what I was making at a locums facility. The other thing that was a sticking point was they didn't want to give me as much time off per year as I was currently enjoying doing locums. So that, you weigh that as well. I think I saw some question about what about transitioning from an outpatient situation back into the inpatient world, which is exactly what I did. And I was afraid to do that. It was very scary for me. And I was lucky then that the institution that brought me in had somebody really sit at my elbow to teach me how to use the EMR system in that hospital. And I found that the staff usually are already well versed in all the needs, that because they've kind of had to do it on their own without a doctor. in those transition periods. So I come in, I usually have a staff that's way better at rehab than I am. So it's an easy fit, and they teach me. And so the transition going from outpatient to inpatient was easy. And I found, wow, I really like this. I had no idea it was going to be as easy and as fun, especially compared to how difficult the outpatient world had gotten to be, you know, around paperwork demands and trying to make insurance payments and all that stuff that just boggles your mind. So it was easy. I like that. I don't know if that answers the question exactly about try before you buy. The other thing is that a lot of locums assignments, you can get them that are maybe just a week or two long. So you can test it out yourself to see whether you'd want to keep doing it more long-term or not.
Okay. The other thing I would, there was one question we had, and Carrie, you may want to step into this. In terms of obtaining PPE for your assignments, has that been an issue with Corona and everything in terms of the different hospitals?
No, it has not. I mean, at first, obviously, it was a little challenging because everything hit so quickly with COVID, but every hospital we work with, that's a common question that comes up with a lot of our physicians that are traveling and going into these hospitals. Some of them are hot spots, and every single hospital that we have worked with has the proper PPE to provide to our physicians.
And now, is there a quarantine, let's say, if you, let's say, go to Florida or something like that, that you have to do before going down there? How does that work?
It's going to depend on the facility. Every facility, and I'm sure.
We lost you. Did we lose you?
I can speak to that. Carrie, I think your sound's lost.
You lost your sound, Carrie.
Oh.
Gail, go ahead.
With the, sorry, your question was surrounding PPE and also if there's stipulations, right, regarding the facilities that they walk into, each physician. So how it kind of works is each facility has their own guidelines regarding what they require prior to the doctor coming into the facility. So what we found is just to be super educated on what are the requirements prior to the physician showing up, so they know walking in their first day, you know, what to be prepared with. Oftentimes we've even scheduled conversations with the staff and the physician to ensure that they're well prepared and ready to walk in and feel comfortable about what the guidelines of each facility is prior to coming in with COVID.
Okay. All right, we'll transition to, next question will be for, we'll start off with Dr. Irby and then we'll open up to everybody else. Dr. Irby, how do you get paid when you're working locums? How does that work?
Well, there's different rates for different facilities, but you know, sometimes they'll offer, for the most part, there's a daily rate that will include just, you know, I mean, it can be anywhere from $1,200 to $1,400 or more. And then if they want to, the hospital can give you $100 or so for just being on call. And then some offer also overtime pay. So, I mean, it varies, but for the most part, they're pretty similar. And I think it depends on what your Leah or Carrie can help negotiate as well. So, and they of course pay. I mean, you're not having to pay for your housing or transportation. They'll take care of that as well.
All right, Dr. Shah.
Yeah, I mean, I would agree. I think, you know, the pager fee, as they call it, which is basically being on call, you don't actually hold the pager. They just call your cell phone. It's between about $100 to $200. And then you have the daily rate, which is for the first 8 hours. And then after that, it's usually time and a half, which I think is really, really important, especially for physiatrists in general. We all know, like, the Friday dump where, you know, 12 admissions might come in, and as a resident or as a salaried employee, you know, you just have to sit there and, you know, just kind of embrace it and get through the work. Where while I was on locums, they did that to me, and I wasn't that upset about it, having to do all those admissions, because I was getting time and a half at that point because they were just rolling them in later and later. And it's nice that your time is actually reimbursed, which I don't think you normally get anywhere else. So yeah, that was my info.
All right, Dr. Holmes, would you want to weigh in on that?
The compensation issue is sometimes gets more testy. When I first started, I just put in an 8-hour day and turned in my time card. And then the hospital representative came to me later and said that I was basically lying on my time card because she knew I was putting in way more hours than that. So she insisted that I put in the extra hours, which put me then into overtime. And I was very happy to see those checks come in. More recently, I found some of the hospitals really object to any overtime at all. And so I've gotten into some arm wrestling around, well, okay, don't pay me overtime, but I'm not going to take a late admit. So if they're going to come rolling in at 4:30 or 5 o'clock, you got to have another mechanism to take it. Then they usually soften a little bit and say that they're willing to pay the overtime. I've had another one who didn't want to pay for me to be on call. Yet the hospital kept calling me and waking me up in the middle of the night. It's like, well, fine, don't pay me call, but then I'm turning my phone off. And then they kind of came around on that. So there's still a tendency of them trying to take advantage of us, whenever they can. And that's where I like having the CompHealth situation, as well as the staff there that'll back me up to say, no, this is the contract. You get 8 hours at this rate, and go over that, it costs you more. So if you get the work done, if not, then they've got to pay extra.
No, I think that's really important. We have one question coming from the audience as to just kind of what happens when you do a locums assignment in terms of lodging and transportation and insurance and benefits. Carrie, Gail, can you speak to that at all?
Sure. So as far as lodging goes, typically the facility does pay for that. Sometimes facilities will have you stay at a location of their kind of something they've worked out locally there. Other times, we arrange the location for you. Obviously, in times of COVID, doctors have preferred different choices. Some want Airbnbs, some want hotels. So it just depends on the physician, to be completely honest. We've seen it clear across, the aisle of what they're deciding they want to do. And so we try to meet the physicians where they need to be met there to ensure, obviously, their housing is one of the most important things. You want them to feel comfortable being in a place that's not their home, and yet, making it feel as much like home as possible, and ensure that they feel comfortable and that they feel like it's a healthy place for them to be during this COVID time. So that's a super important thing we've tried to put a lot of focus on. The other part that you asked about is insurance. So we cover the physician's malpractice as far as the malpractice goes when they come on assignment with us.
All right, outstanding. And I also wanted to, continue that. There have been a couple questions in terms of how do you get started in locums in terms of the whole process of application and credentialing and all that. So either Gail or Carrie, can you all speak to that at all?
Sure. If we have physicians, and hopefully I won't mute out again, but if we have physicians that are interested in doing locums, they would just reach out to one of the recruiters. Depending on the specialty that they're in, we handle all different types of specialties, and we would just send you a link to start an online application to start the credentialing process, and then we would just talk about specific opportunities. Every job's going to pay a little bit different. But the first step would be just to get in touch with one of the recruiters from CompHealth and start the application process.
Okay. And do they have to have finished a residency and board eligibility? How does that work?
You don't necessarily have to be board certified. Of course, I think as far as I know, the only specialties that you can really work and do moonlighting or locums before you complete your residency is like family medicine, urgent care, or I think it's emergency medicine. Specifically to rehab, you do have to complete your residency before we can actually work with you and place you, but you do not have to be, you have to be board certified or truly board eligible, which is typically within 5 to 7 years of your residency or fellowship. Most hospitals do require that due to their bylaws.
Okay, outstanding. All right. The next question will start off with Dr. Holmes. Dr. Holmes, how do you handle your taxes when doing locums? How do you manage that?
Well, I don't do it myself. I've hired an accountant to do all that for me. And this particular firm is experienced in looking at all the different state rules and tax situations. And the nice thing with CompHealth is when they send me the W-4, whatever it is, at the end of the year, it has listed at the bottom a breakdown of what money I've earned in what states. So my accountant then takes that and figures out what money I owe to which state based on all the different rules there are. I mean, some states have reciprocality, some don't have any state taxes. And so it's gonna vary state to state, and you have to give your accountant all that information. The other thing I did was I set myself up as an S Corp, and that allows me the advantage of an awful lot of business deductions that just goes straight into the corporation versus me as an individual where I wouldn't get to claim those things on well, I could, but I have to meet a basement floor amount before I could start claiming them as a deduction. Whereas because a corporation, any penny I spend that's business related, it's all deducted. And that's nice.
Now, as an S Corp, do you like pay yourself a salary and take out payroll taxes and that kind of thing?
Correct. So I get a certain salary, and then whatever the extra income is that the corporation earns then is returned to me as capital gains. And I'm only taxed for Social Security issues on the part that's the salary. That's the whole point of setting up an S Corp, is to be able to do that.
Okay, fantastic. I think that's very important in doing locums, because there's a question about being a sole proprietor, and I think one of the disadvantages of doing that is that because CompHealth doesn't take out any taxes, and if you don't do estimates and you're a sole proprietor, you're going to get slammed at the end of the year. The second thing is that you're also liable to any type of malpractice or any type that someone could come after your assets, your personal assets, where if you have an LLC, in particular S Corp, you have some protection with regards to that. So I think that's real important. Okay. Next question I'd like to direct to Dr. Irby. How have you used your locums experience to ease into retirement? How's it helped you?
Well, like I said, it was like Dr. Holmes had mentioned, I had an outpatient practice, and I kind of started just, I knew I wanted to retire eventually. And I know when you have an outpatient practice, it's real hard to close. And, a lot of it has to do with different states have different rules, like, maintaining medical records. And so I had an opportunity to just get out of mine in an easier fashion, and that's why I just started doing inpatient rehab, knowing that was probably going to be the last thing I did as far as my career. And that was easier in the sense I didn't have to maintain records. I basically just billed for my services in the hospital setting. I didn't have overhead, and so that was the one transition. The next one was getting rid of my directorship. As you know, if you're a medical director for an inpatient rehab unit, your hospital is basically counting on you to man that unit with the PM&R doctor, no matter what. So if you don't have the peers or coverage, you're on 365 days a week, 365 days a year. So it was a challenge, because I did have people that would help cover me and vice versa. But it's always a hard thing to want to take time off, knowing that person is overwhelmed for that week or that, long weekend that you're taking off. So that got old after a while. And so I said, well, I had to, why I wanted to try locums, and I did. And you know, I got rid of that, you know, responsibility of having to be on call all the time, and it's worked out really good. I can work when I want to, and there are times when I feel, oh my God, I don't have enough work and I need to do more. But for the most part, everything's been working pretty good.
Outstanding. All right, next question will go to Dr. Shah. I think you may have alluded to this earlier, but we'll go to it again. How was it coming out of residency and working locums? How did that transition work out for you?
Yeah, you know, it's like any time you go into a new facility, it can be a little bit nerve-wracking and a little bit anxiety-driven, but I thought it was great. I'm really, really happy with the decision I made to do that, not just for the family, but for my personal growth. They kind of say like the first couple of years coming out of residency, you have an exponential of learning, as well as you never stay at the same job. Well, I technically did, staying with CompHealth and doing all the locums. You know, to kind of touch on a couple of the other questions, like testing the waters, you get to kind of see what you really like and what you don't really like. So, you know, say you decide to do locums for a couple of years coming out of residency, then you can kind of hone in on what type of job you want, if you want a little bit more of a permanent to transition into. I think that's advantageous. Also, you can kind of learn to feel what you don't want, and it'll teach you how to stay away from that. Also taught you how to to get really good at interviews and learn how to kind of carry yourself. I thought that was really important, as well as really taught you how to go into a unit and kind of control the unit. Yeah, a lot of them are really happy that you're there, but you know, you want the unit to run in the way that works for you and works how you were trained, and you have to get kind of that hive mind in order in a short amount of time, and it really teaches you kind of how to do all of that. One kind of another like anecdotal story is one of my buddies that I met, he came out of residency as well, and me and him, and he did locums, and me and him were kind of talking about it, and he was like, I'm so glad we did this, because I think 80% of our graduates, they all switched their job because, you know, kind of what they got into wasn't what they really wanted or envisioned, but they didn't know that until you know, they got there. Whereas, so when you do locums, you can kind of say, hey, this is what I like, this is what I don't like, so that you can kind of make the practice for your future the one you want.
And I'll just make a couple of comments on that. I think Dr. Shah mentioned, I think one of the things that it does is it teaches you how to be efficient with your time and how you want things run. And you can identify the staff that gives you a lot of assistance and everything like that. And as you know, a lot of people who change jobs, when you do your contract and go to the job fairs, they're going to promise you the world. And then when you get there, you find out that the world is just, you know, instead of being the world, they give you Afghanistan or something like that. So you find out that it's not quite as rosy, and the expectations that they had you do or something, their staff person left or something like that, and they say, well, we want you to pick this up too. And so after about a year and a half, you're like, well, this doesn't meet to what I thought it was going to be. So I think you end up switching jobs, and particularly if you have a family, you don't want to be moving around every 2 or 3 years with a job. So I think locums allows you to have not only look at different spots, but also if you're not ready to move, allows you to kind of stay in a certain area for a period of time until you are ready to move based on what you see in terms of the market. The other thing too, I think that's very important is that because the assignments are, you're not working, you work kind of when you want to work, particularly if you're coming out of residency and you're studying for your boards, it gives you that time to do that study. So you can make money, 2 weeks off, maybe work a month or two before your boards, and then have that saved up and then just kind of relax and do some studying, as opposed to trying to squeeze that in and then have a start date with your job and having all that pressure on you to get your boards out of the way, plus work and move your family and all that. So I think with locums, you can kind of say, okay, let's take a pause here. Let me, work a couple months, take my boards, and then I can just kind of not relax, but just kind of work at my own pace, until I'm ready to make a permanent move. So I think it's very helpful from that standpoint.
Yeah, just to interject real quick, I would like to reiterate your point of the overpromise, underdeliver is abundantly real in our line of work, and it happens quite a bit, and it can be really a downfall if you're not able to identify and really kind of a clear picture of what you want moving forward.
Okay, we'll go to our next question. And this is to everyone. Why is it beneficial to work? And we've kind of gone through this before, but we'll just go through it again. Why is it beneficial to work with an agency when with working locums? And what can the recruiter, in this case, Carrie and Gail, can do for you in negotiating contracts and organizing travel and housing? How have you found that to be with CompHealth or any other company that you work with? Dr. Irby, we'll start with you.
Okay, well, I've only been with CompHealth. I think CompHealth has been very organized as far as helping make sure I have, you know, I personally like to arrange my own travel and my own Airbnb because I don't like hotels, and they're very accommodating with that. So they just reimburse me, and if there have been times when they just go ahead and make those arrangements for me, but that's the only company I've worked with, and I find it very, they go out of your way to make sure everything is in order.
Good. Dr. Holmes.
Well, I find, some of the colleagues I've worked with have worked with different locums companies, and they've told me that CompHealth is superior to the services they've gotten from some of the other companies. I've been approached sometimes to step away from CompHealth because some hospital or person wanted to hire me basically and pay much less than what they'd pay CompHealth. And so they tried to attract me with a little bit higher fund, but when you start digging into the weeds, you go, well, yeah, but I got to pay for my own malpractice. I got to pay for my own hotel and everything else. And by the time you do that, it's like a wash, only it's a lot more hassle. So I've really appreciated working with them, the travel department there. I'm like Dr. Irby, I tend to set up my own my own airline schedules, but then they book it and pay it. And then I don't have to worry about any of that stuff.
All right, Dr. Shah.
Yeah, for me, it's been, you know, a real joy to work with Carrie and Gail. I think I think what they make it really easy, first of all. Second of all, they really listen to you and what your needs are and what you what you want out of the job, and they try to bring that to you as much as they can. On top of it, it's always nice to have somebody in your corner, as Dr. Holmes was talking about, them trying to not pay for you know, being on call, or they want want you to take a late admission, but they don't want to pay you an overtime for it. You need somebody, and it's nice to have, you know, multiple people be behind you. Otherwise, you're having to make the phone calls and doing all of this stuff on your own, and that ends up being more work. And you know, it takes away from the advantage of, you know, when you leave an assignment, you're done. Nobody's calling you to follow up about the patient. Nobody's, you know, asking for prior auth or anything like that. When you're done, you're done. And, you know, they kind of take care of everything and make it as easy on you as possible to just make sure that you can concentrate on being a doctor, really.
Outstanding. Had a couple questions, and I'll direct this to Carrie and Gail. Have the virtual telehealth medicine affect locums? Has that been an issue at all?
So it has changed our business quite a bit with COVID. So we were looking to get into that space a little bit more. However, with COVID coming, it's actually kind of fast-tracked us into the telemedicine sector of the business a little bit more. And so we have started to enter that space a lot more with many of our specialties within CompHealth. And we are actively working several assignments, you know, across our entire company. and are entering the space more and more every day as the needs kind of arise. So every team is set up to do that, to ensure that we can help a facility make sure they can fill those needs. So yes, I would say absolutely, it's getting more and more common in the space of medicine right now.
How does that work? How does that actually work with that?
So how it works is typically the facility has their infrastructure set up on how they want the doctor to kind of work the telemedicine. And if they don't, typically they will instruct the doctor of an app they can use to get the telemedicine set up. So it's a little bit, it depends on the facility and kind of their infrastructure of how we go about doing it. But we make sure that obviously the doctor has the capability of, being able to take the telemedicine calls as they get them. So it really just depends on the facility and their setup, but we go over all of that prior to, somebody accepting an assignment to ensure that that capability can be done with each side of the equation. So both the facility and the doctor.
And a couple of the questions regarding licensure. The first one is I think the Interstate Medical License Compact. That's, I guess, the licenses that can extend beyond, within the Midwest. I think there are about 6 or 7 states. Someone asked a question about that. And then the second one was, if you've had a license that's been inactive, how long is it easier to reactivate that license if it's been inactive for a period of time?
Yeah, and I just answered that online, but basically it's going to depend on the state license and how long the license has been inactive. Every state's going to be different. Every state has their own requirements. There's been situations if the license has been inactive too long that we have to start over from scratch, like it's a brand new license. Some it's just a matter of paying a fee and we just get the license reactivated. So it is going to vary state to state.
And the nice part about that is, I know many of you physicians actually that have worked with CompHealth, in the past, you've had to fill out your own state license applications. Effective here in the near future, we will be doing some of those applications for you. So taking a little bit more off your plate. Each time we continue just to improve those processes. So that's a nice feature that's coming your way as well to make it a little easier for you as a physician with less paperwork.
And I would say that the licenses that are hard to get, that take a little bit more time, I would say to those who are interested in locums, make sure you keep them. For example, Texas is to be a little bit of a bugger because of what you have to go through to get it. But I've had my Texas license for about 25 years now, so
Yeah.
it was a bugger to get it. So I'm not giving it up. So when the locum assignments come up in Texas, I'm always ready. So that's very important. Yeah, so some of the licenses that are hard to get, I think you got to make sure that you maintain those, because once you let them lapse, they're kind of hard to get back in. And particularly, California, Florida, I think Texas, those are the 3 big ones that tend to be a little bit problematic in terms of trying to get, you can get them, but it's just going to take some time. Let's see. Let me see if we have any more questions here that we can maybe address.
There's another thing to bring up on that license issue, since I've got so many of them. They're now, some states are throwing in some extra CME requirements, usually around opioid prescription stuff. And what's odd is that the thing I need to do for New Mexico, which I didn't cover for the thing that I needed to do in Oklahoma, which needed to cover some specifics of Oklahoma state law. And then neither of those, I think, apply to what Minnesota now wants from me. So even though they only need like 2 or 3 hours of CME credit, I'm going to end up having to get like 15 hours of CME just to satisfy these different states' small requirements for relicensure. Massachusetts used to have something around, it was liability issues that they wanted us to do 3 hours in. And it was like, well, I don't live in Massachusetts, so how am I going to even find a CME that would give me those hours? So it's something you have to be aware of. So when it comes to renew your license, you suddenly don't go, oh no, I'm missing 4 hours of something that I never knew I needed to get.
Let's see. I'm trying to think if we have any more questions here that I can kind of address. Yeah, I think there's one. Is there any states where you can get a license with 2 years of residency? I don't thinks, I'm not sure. Most places, I think you have, if you do your internship, they usually have an institutional permit that you have, and then I think they at least want you to pass step 3 of your USMLE before you can get a license. So I think you can have 2 years of residency. I think it's more so when you pass step 3 that you're able to get a permanent license at that time, as far as I know. Okay, we've got about 5 minutes left. Are there anything that the panelists want to add to their locums experience and that we can address it all at this time? And then we have some questions that we'll get to offline.
Well, I saw a quick question about whether there were any outpatient experiences available, and there are. It's just, I don't want to do them. But, you know, I know Carrie periodically will come up and, okay, we've got this thing, it's outpatient, this many patients a day kind of a thing. So those things are available. The other question I saw had to do with, is there locums international? And I would love to do that, but I've never run across an opportunity.
Yeah. Gail or Carrie, are you aware of those opportunities? I know you don't do international, but have you heard of other practitioners doing international and what their experience has been?
Yeah, I want to say a few years back, I don't remember how long ago, we did acquire global staffing who does international staffing for physicians. I've had physicians myself do international travel on a locums basis, but it wasn't through global, I don't recall, but they have done it and they've had that experience. I've had a few physicians work in New Zealand.
Oh, okay. Okay, Dr. Shah, did you have anything that you wanted to add as we close out?
Yeah, sure. Just a couple points that I think we kind of brushed over, but you know, we talked about being paid for your time. I think that's also important, but you also get paid on time. When you put in your hours, it's on that Friday, you're going to get a paycheck. And I know, you know, for me, like in residency, that was great because that you knew when you were going to get paid, but you get paid so much quicker for the work that you do, you know, through the locums with CompHealth. That, you know, it makes budgeting a lot easier, I will say, from my point of view.
Yeah, and to Dr. Shah's point, I think that's very CompHealth makes sure that you get paid in a timely fashion, and I think that's very important. I know when I worked in Arkansas, again as a faculty member, we got paid monthly, and that can be a challenge when you're trying to you just hope everything the account is got something in it before the end of the month, before your next paycheck. So that could be a challenge. So I think that's real important. Dr. Irby, did you have anything that you wanted to add?
Yeah, just on that topic too, I think Dr. Holmes had mentioned this earlier too, but we definitely, if you're in private practice and you're just used to doing your own billing, you may not collect on a certain patient or Medicare for months. So it was very refreshing to be able to, you know, when I started doing my locums and they were saying, oh, you got to put your time in to get your check on this Friday, and I'm like, really? That quick? But no, I was really impressed. They very, it's nice to get paid right away for what you do.
Yeah, and I think that's important because, you with locums, you don't have to worry about all the hassles of terms of insurance and billing, and it's just, you know, you just know, put in your time and then your check comes in every Friday. So
I just saw a thing about benefits, which is probably one of the downsides to doing locums work. Like for me, being an independent contractor with my own company, I don't provide, well, actually, there is a way for my company to pay for my health insurance. But trying to find cheap health insurance or other things that you might get automatically when you work for a hospital, that's just not there. And I don't know if Carrie knows of anything that may be strung together through CompHealth as like an offering for not so much malpractice, but for personal health insurance, dental, stuff like that.
I'd like to jump in just real quick because I actually have some a little bit of experience. I was thinking about looking into getting cheap health insurance, and after you opened up your S Corp, you can become like wherever that S Corp is, become part of the business bureau there, and usually they'll have a group health insurance that is actually not too expensive. So that's kind of a way. You can also look at if I didn't look into it that much, but if AAP Menard does, or any other of the specialty groups, if they do a group health insurance.
All right. I think we're about done. It's 8 o'clock, and I don't want to take up the panelists' time, too much of their time, and we appreciate it. Again, I want to thank our expert panelists and to each of you who participated with our webinar today. As a reminder, we will be sending out an email to each of you shortly after the call with a link to this webinar and a link for the quick pulse survey. Thank you for taking time to join us in the discussion. Obviously, we've barely scratched the surface, but we hope that we have left you with some ideas and information to apply to your team, organization, and personal engagement. Any questions? Any other questions? Okay. We will take these offline, and we'll try to, again, we have a link that we can provide to you all, and we can, if between Carrie and Gail and Madison Archibald, who are available, we can attend to those. And then also for our panelists, we can also answer those questions offline. So again, thank you all very much. And also want to thank CompHealth for help putting this together. And hopefully also we benefit the Howard University Medical Alumni Association for the participation, as locums is definitely an option for those that really people don't know about. And I hope we've provided an education for you all into possibly pursuing this at the beginning, middle, and end of your career. I think it's been very beneficial for me and for our panelists, as well as those who've done it all across the country. And I just like to, one of the things I want to do is get people aware of this and how it can help your practice and help your career. Thank you all very much.
Thank you.
Thank you so much, Dr. Dawson. Thank you to all the physicians, and happy National Locum Tenens Week to all of you. We appreciate all the care that you give to the patients out there.
Thank you. Have a good night.